So hello everybody, my name's James, I'm a final year medical student at Newcastle University, and today I'm going to be talking through a little bit about my typical day on placement. So I'm actually coming up to graduating, so I graduate in July, and I'm on my last assistantships. So these are 4-week blocks in a medical ward, a surgical ward and a GP practice, and essentially it's your last chance to follow around the junior doctors, experience as much of the sort of day-to-day job that you can do before starting. So it's a really fantastic time to sort of really focus on the nitty-gritty of what I'm going to be doing day in and day out. So I'm based in a GP practice at the moment, so in King's Medical Centre in North Ormsby, and so I start my day by having some breakfast in my flat. I'm living sort of in the centre of Middlesbrough, and then I'll walk with my flatmate Liam across town about 30 minutes, 40 minutes, and in this kind of weather it's actually a really nice time of the year to be in the GP practice. I'd walk up to the GP, get signed in, have a look at which patients have been booked in for me, and I tend to have pretty much a full day by 9 a.m. because as everyone knows, appointments are in high demand at the moment. Then I would go into my room, get set up, get all of my equipment ready and get ready to start the day. I might make a quick cup of tea as well if I've got some time. So there's quite a lot to do in a half an hour appointment. First of all, you obviously welcome the patient in, you would set the agenda. So, hi, my name's James, I'm a final year medical student. Today we'll be having a little bit of a chat through your history and perhaps performing an examination, and then one of the GPs will come in and review kind of my findings and we'll come up with a plan to take forward from that point. So it's kind of setting the scene as the patient comes in, taking a history, performing an examination. I might take their observations, so their oxygen levels, their temperature, might have a listen to their chest if they've got a cough, and then the GP would come in and maybe confirm any findings that I can hear on the chest, and if a chest infection is suspected, for example, we prescribe some antibiotics, or maybe go through some counselling around if it's maybe more of a viral infection, why antibiotics are slightly less appropriate. So it's very communication based, communication heavy, and it's a great way to sort of feel the most doctory I have kind of all through medical school, so it's really quite an exciting time. So there are around half an hour breaks, one in the morning, one in the afternoon, and we have quite a long lunch, and this gives us the admin time to catch up on any documentation we need to write for the patients, and also just to sort of have, if there's any meetings as a GP practice, to discuss through any findings from audits or quality improvement projects that have been run. And also we can nip out to go get Greggs as well, which is kind of my go-to at the moment because I'm not organised enough to make my own lunch. And then the afternoon starts, and I've actually been running surprisingly to time the last sort of few weeks. I think I'm finally sort of getting comfortable with sort of maintaining momentum in a consultation and keeping the patient informed throughout. Yes, and then sort of towards the end of the day, there's a little bit of leeway as well just to sort some admin. And then I would set off, so walk home, get logged off, thank you for running the practice obviously, and then get home probably around 5:30, 6 o'clock. So I'd love to say that once I got home I sprung into action and was incredibly productive, but often after a day at GP I'm quite knackered. I think my sort of social battery is somewhat drained. But often as a house we get on really well. We might play some board games, particularly because we're based in Middlesbrough this year. I often go across to Saltburn by the sea and have maybe a dip in the sea, particularly with this nice weather. Make the most of it while it's around. And I'd make myself some tea, and just maybe relax, do some reading as well, and then try and get as early a night as I can because I'm in early the next day as well. But no, it's a really, really fun time. You've got some GP tutorials as well, so some teaching in between during the week, and you look forward to the weekend and you've earned your weekend all the more. But no, I'm just really excited to get started, and I feel like this is the perfect end to 5 years at medical school because I've felt the most like a doctor I probably will do in medical school. So sort of wish me luck. I'm very excited to get started.